thank everybody, even though you might be into the IT space and the health science and healthcare facility, for supporting all the frontline workers and everything through the pandemic. Obviously, we could not do this without your assistance. And I want you to know from myself and associates and probably everybody else that talked, we appreciate that greatly. So with that, let me dive into a little subject matter for the standpoint of what we're going to talk about today. Of course, I can't speak of everything regarding ALLOT and what we do in a short period of time. I just want to make sure that I don't know why, Ron, I can't move to the next screen here.
Okay. Well, we've done these things many a time before.
There we go. I don't know why I did that. My apologies.
No problem. I was all set to be your Vanna White. All yours, Bob.
Okay, a little glitch. So a brief thing, I'm sure, and I'll tell you why, that some of you maybe are not familiar with us, even though we've been in business roughly about 25 years. We are a public company, but we've only been in the enterprise space around 4.5, 5 years. So ALLOT started as a T1, T2 provider. Most of everybody here, regardless if it's AT&T or Verizon, Rakuten, Dish, and the list goes on, Telefónica, I won't bore you with the details, are all customers of ours. Basically, we're a leading provider of innovative traffic intelligence and security solutions for thousands of enterprises worldwide. We are a global company. Our solutions enable these enterprises to maintain business continuity and efficiency by assuring basically the digital experience delivery to employees and customers and patients. When I think about challenges in the healthcare organization, research that I've done, consultative approaches I've done with several hospitals, mainly in the Midwest, I'll share with you. What comes to mind today, of course, is COVID-19 and the impact, the revenue and business operations of healthcare and life science organizations. I think one of the key things that I'm going to try to show you today, along with my associate David Marshall, is how important strategic planning and future planning can be for all healthcare organizations, including, since I've consulted to several, and I'll name a couple, okay, when it comes to even medical universities, because sometimes the medical university might also have a hospital and they might be sharing resources. So I know that here in Chicago, where I am, University of Chicago and the University of Chicago hospitals, they share resources. Northwestern University, Northwestern Hospital, they have shared resources. So that might be similar to some of the people who are attending today. I think one of the key things we can agree upon is that there's been disruption. And I think with legislation in the future, some of you who might have, you're reading things on what high tech is demanding and things that are coming out, we'll have more disruption, which basically equates to change. And that's always going to happen in our industry. And I think that for today, we have to focus into that impact. How big of an influence will each trend have in the next 12 to 36 months? And then the key element today is, what is the readiness? In other words, how confident are you in your organization's ability to address that trend? So from ALLOT standpoint, we mainly cater, I would call it, to mid-large. Recently, I don't want to get into models today, but recently we did come out with 2 smaller models for, we'll call it smaller clinics, smaller businesses, organizations with smaller bandwidth, right? We have a global presence, so all of our support is follow the sun, 7x24. We are public, as I stated. We have a strong balance sheet, and last year we did about 136 million. This is just a glimpse of logos that I thought I'd share, since I know that a lot of people maybe have never heard of us, and a number of names that you can see across the board here in different verticals of who we've done business with, just as a glimpse. So when we look at solutions and we look at trends and we look at the future, I think that from healthcare and life sciences, all the challenges, we have to look at what those trends are. And here's basically 5 trends that I feel are creating challenges today, right? These trends can dictate into many different segments. And what I mean by that, when I think of concerns in the healthcare that I've heard of, is, how do we handle mobility or BYOD? Or now we have mergers and acquisitions going on with different organizations and different, we'll call it applications. How do we handle new applications and their delivery? And now with even legislation, I'm reading about sharing between organizations that data and protecting it. So we assure that high quality digital experience. That is our expertise. That is what everyone learns very quickly of what our capability is. One of the things that differentiates us that you should know, again, not getting into models, but we handle everything from low bandwidth of internet into terabytes. So there isn't a size that, we don't fit. It's just a mannerism of what do you want to do, whether it's on-prem, whether it's cloud, or whether it's hybrid. And then on top of our DPI engine of what we do, and dynamically recognizing a multitude of applications, we also then can protect through DDoS protection, which I'll show you a little glimpse of in a future slide. And so if anything you walk away from today regarding ALLOT, I think one of the key elements is that provider of intelligent IP, we'll call it service optimization, that it'll help your network run more efficient. One of the challenges that I've seen grown, and this is data that I pulled, so is the standpoint of just taking into account telehealth and telemedicine. With the pandemic and everyone's safety, of course, we saw that jump in 2020. And I think one of the things we can all agree upon is when we talk about disruption of how is that going to impact moving forward. So it's only grown now in 2021. And even though that might come down a little bit, I want to say in 2022, I think people are starting to realize this might be a new trend that we might need to service through this methodology. So ALLOT really focuses in 3 key areas. I think one of the most interesting ones that David's going to talk about later is our visibility and how granular it can get. And you'll see that through customized dashboards and things that can be created so that you can have one glimpse within the dashboards that are specific and mission critical to your environment. Then the other part that is really key is the standpoint of the control that we can provide. In other words, now all of a sudden we give you the control back from your application and user performance, regardless of what that application is. And even though we pretty much recognize everything, I have seen some customized apps, and as long as we can point to that IP address on the server, we can name it and still see it and still control it. And then the last is security. So there are some other security features that you'll see on our website, I'm sure if you go on it later on, and other, we'll call it devices that we have. But again, for today, I'm just focusing on the DPI and a little bit on the DDoS and visibility. So when you are making a decision, I think one of the key things is you have to see what's going on. And with networks becoming more complex and the multitude of devices and additional applications, this creates a demand for delivery, we'll call it assurance. Understanding how those resources are consumed is critical to the success of the experience, not only for doctors, but nurses, and most important, I would believe everyone would agree, is the patient's opinion. So the user's opinion really is critical to how everything forms. And then today, I think Ron even mentioned it, and I agree, that IoT is going to become even more impactful. And then you need something that can not only see those devices, but also then sanction those devices to make sure that we're providing that QoS that you've envisioned. And through that, I've seen, at least here, and I'm assuming this is going across the board in the US, I've seen a consolidation of hospitals in the Chicago area. I've seen the Advocates grow. I've seen the North Shore University system grow. I've seen Northwestern grow. And so I'm not seeing the individual hospital as much, but I'm seeing this consolidation. And then I'm seeing a multitude of extensions of clinics and labs where people can go for blood work or gain access to a doctor without having to travel specifically to the hospital. And the reason I bring this up is in the first definition of round-trip traffic management policies, it's to the standpoint that with our device, you not only gain the visibility, but you gain that reporting to say, is this acceptable behavior between our clinic or hospital in sharing patient data or telemedicine between there, or devices of applications that might be stored at, we'll call it the hospital, in the data center, but being shared through clinics or other organizations. And we provide that along with numerous reports on a number of factors that can then allow you to decide whether you want to tweak or tune that. Or when it comes to wireless, how do I create for my mission critical flow fair and equal access, whether that's roaming devices for nursing staff or things of that nature. So I think the other aspect in order to gain that assurance, we'll call it, is the standpoint of identifying what might not be mission critical to your environment. And then philosophically, we'll say, deciding, do I want to allow that, and to what capacity do I want to allow that? One of the unique features that we have is we can actually partition, if you will, a segment of bandwidth just for patients, so it won't step on or congest what the clinic or healthcare organization is doing that is mission critical. And so we can segment, if you will, from that standpoint to users or group of users throughout the healthcare facility in order to provide you with the, we'll call it, assurance and quality assurance in that digital experience. This is the glimpse of the dashboard that I wanted to share as far as DDoS is concerned. So we do have security offerings that can sit on top of our DPI engine, and this is just one of them. In this, you can just see, we'll track the number of attacks, we'll track the duration of that, how long they were, the peak bandwidth. The most important thing in this slide, while you gain all this data, is also knowing that any DDoS attack, even if it's small, we will mitigate that attack in under 8 seconds. So that is a key element, and it's all dynamic. It's not like any alerts are happening or things of that nature, but yet you'll have the log file in order to research and see where that's coming from, since we see all traffic coming inbound as well as all traffic outbound. I'm not getting into the specific platforms that we have today, but I just wanted you to see from the low end, we have our ACG units, and they can handle up to 2 gigabits of throughput. We move into our SSG units that can go up to 40 gigs. And then for our SG series, we have a number of tiers that go from 40 gigabits all the way to a terabyte. This, of course, includes, we have central management with this, on top of a number of security offerings that we have, and we can do that. Again, I listed high availability as far as how we can set things up. We've worked with numerous cloud providers where we have customers using Amazon as well as others. And I think that from ALLOT's perspective, you can see that we provide not only the view that I've shared with you today, but the network and security so that you can quickly, I'll call it, assure your IT operations and your application services to provide, again, that end user excellent digital experience. I'm going to pass the microphone, if I may, to David Marshall. David has a number of acronyms that, as far as security and engineering and CISSP and more. So he has been with ALLOT, I'll call it, multiple years, and not only has done a phenomenal job with North America and Canada, which I'm responsible for, but he's also assisted global customers. So David, the mic is yours.
Hey, thanks, Bob. Again, my name's Dave Marshall. I'm a solution engineer for ALLOT. And Ron, I'm sorry, I'm going to try to keep this quick. I know I'm going to keep everybody wants to get something to eat. So just to start off, so today's networks are increasingly complex. They're increasingly critical to the success of the applications and services that run on them. And with COVID and telemedicine lately, the user expectations are at an all-time high. The healthcare network needs to be up, running, and high performing all of the time. At ALLOT, we've been addressing these kinds of dynamics for over 20 years, and our solution is deployed in addressing these issues in hundreds of medical facilities serving networks all over the world. We absolutely believe the answer to a reliable network is visibility and control. The ability to answer questions about your network, whether they be corporate, cloud, or internet, is crucial. Your network team needs tools that can quickly give them visibility into the network, giving them trend analysis of QoE or quality of experience, scores at the IP, VLAN, device, or even down to the network application is, again, crucial. Recently we had a customer that installed our solution at a large outpatient center. Now, she was in charge of managing the congestion and prioritization of the corporate internet over lobby Wi-Fi. And this is done easily with our product solution by shaping rules at the VLAN level and then limiting streams per user. And this is also we were also charged with preventing device updates in the lobby as well, which saved a lot of bandwidth on the network. Now, while deploying the system, she received an inquiry from a doctor. He had been having problems with this dictation application. Now, I think it was dragging, and I know it's not necessarily a critical application, but I wouldn't suggest making that argument with the doctor there. Trust me on that one. So using the ALLOT solution, she was able to quickly narrow the investigation down, not just to the device or even the application, but to the exact remote proxy server that was introducing latency. And in this case, it just causes a sluggish experience. It's one of those stubborn processes that work just enough to cause issues, but not enough to cause the application to fail and easily be diagnosed. We all know those type of issues and problems are especially frustrating. So she was able to swap the redundant proxy server and the problem was resolved that day. She was thrilled and told me this type of issue would usually take days to diagnose, but with the ALLOT solution, she was able to do it and isolate that problem in minutes. Now in our industry, bringing that MTTI or mean time to identify and the MTTR or mean time to resolve them down to an acceptable level is everything. But it's not enough just to know where the problem resides. It's also about the ability to control and prioritize specific context within the network. The ability to shape traffic at any combination of IP, VLAN, device, application, even down to the specific time of day is imperative. Now listen, if this resonates with you or your team, if you have any specific applications that need prioritization on your network, whether it be in telemedicine video or even quickly diagnose issues with your dictation application, I invite you to start that conversation with ALLOT. Bob and I would like to thank you all for your time, and don't forget to download our case studies. We'd love to hear from you.